live. Good evening. Welcome everyone and thank you for joining. Today we're joined by Dr. Connie Scuccimarri. She's from the public sector. She has a PhD in child psychology and is the co-founder of the Coalition of Psychologists from the Quebec Public Network. In the public sector, the wait for mental health care was on average of a wait of 8 months, according to statistics from January of this year. In November, 19,000 people were on a waiting list to receive public mental health services. Not only is there a greater need for mental health during the pandemic, but mental health care workers are being overworked. Welcome, Dr. Scuccimarri. Thank you so much for taking the time to join us today.
Thank you for having me.
So I'm just wondering, have you felt the effects in the increase of need of mental health services since the start of the pandemic?
Absolutely. I mean, we've all been working really hard since the first wave. Some people have stopped working and some people were reassigned, but psychologists were so needed in the public sector, and there's some people in specific areas that had no choice but to continue seeing patients, and a lot of them, the numbers were horrible. It was 1 in 5 people showing symptoms of anxiety and depression in September, and then after that it just got worse. I mean, the numbers were 1 in 4 people showing signs of anxiety and depression. Compatible with, these are diagnoses that are very severe, and in kids it was worse. The numbers really showed horrible consequences of the pandemic. Just the beginning, I think everybody was in the acute phase, which is just the shock. But a lot of people, it just got worse with time. It was 1 in 2 of kids between 15 and 25 had shown signs of anxiety and depression. It started off 1 in 3, and then it got worse as time passed. To 1 in 2 kids. So not only did we have our kids in the public sector that had already problems, we're talking about, the people in hospitals with illnesses and accidents, there's things still went on, but we had the added problem of the stress and the anxiety that the pandemic caused that just made things a lot worse for kids who were already stressed.
Okay. It's good to hear you talk about these things, because I think often in mental health, kids are kind of ignored, at least from a lot of the coverage I've been seeing. And I know I didn't even get to touch on that in the video that I recently published. So I know that you touched on this a little bit, but have you had to turn away clients or either put clients on a waiting list?
Yes, unfortunately, the waiting lists got longer. It's just too much demand, and unfortunately, we have a shortage of psychologists in the public sector. So basically, what's happened over the past 10 years, the number of psychologists has decreased. And with the pandemic, I mean, it's not. It wasn't just the pandemic's fault. This was a reality before. Mm-hmm. We were missing manpower. And of course, the pandemic was very, very difficult. It still is very difficult. There is a lot more burnout. There's a lot more people who have a hard time meeting the needs. I mean, they have their own stressors, but they have to also continue being workers with very complex difficulties. So yeah, our waiting lists got longer. And, like you said it in your report, I mean, it was an excellent report, by the way, between 6 and 24-month wait is just unacceptable. Some people have less, but some people have, that high amount. And again, that's a whole big topic. And how do you manage and deal with waiting lists? And it's quite hard. And I know myself, I mean, I'm always trying to do more, but at one point, I mean, you're just human, and you have to put people on wait lists, and it just breaks your heart. So you're really always pushed and pulled with very difficult decisions.
Mm-hmm. Thank you so much for talking about this. Before we went live, you and I were talking a little bit about your work at the Coalition of Psychologists from the Quebec Public Network. Could you tell me a little bit about this and how you got this started?
So it's been about 3 years that some colleagues of ours, we got together and we thought about, what can we do more in the public sector? We just seeing the numbers of psychologists decreasing, and we just, we know that there's a lot of psychologists like us thinking that there's got to be something to be done. So we developed this coalition of psychologists in the public sector. And basically, it's a nonprofit organization with the main purpose of recognizing the importance of psychologists' role in the public sector. Because basically what we want to do is we want to increase accessibility of these services, psychological and neuropsychological services, to the public, to the people that can't afford to go to the private sector. They should be getting services in the public sector, just like you're getting physical health care in the public sector. You should be getting psychological health in the public sector. So basically, we want to increase that accessibility, but we also want to decrease the exodus of psychologists leaving the public sector, because we're seeing it. It's like I said, in the past 10 years, the numbers have unfortunately nonstop. People are leaving the public sector to go to the private sector. And so we're working together and finding different ways to attract the psychologists back in the public sector. And we're working together in so many ways, writing letters, meeting government officials, posting on our Facebook and our website. We've done a lot of sensitization and information, and we're really trying to make some changes so the government hears us.
What are some of the changes that you're asking for?
So basically, with many studies that we've seen, these are studies from different unions across Quebec. They've made some surveys and asked people. They've polled the psychologists. And they've seen that the number one reason why psychologists are leaving the public sector to go to the private sector are the unsatisfactory working conditions. And then if you look more specifically, those are based, of course, on we're not getting recognized for the specialty that we have, the number of years of studies, the specialization that we do in our internships, our residencies, and we have unfortunately not been recognized for that. And, not only salary wise, but also in terms of our working conditions. We have been over time, unfortunately, people are not satisfied, psychologists are not satisfied, because more and more psychologists are being told what kind of treatment you have to do for your patients, when we've been trained 10 years in university to find that method of treatment, that intervention. Obviously, the policymakers want a fast fix for the patients, so you can, decrease the waiting list and go to the next. But it's not in 10 sessions that you fix depression or you treat people with post-traumatic stress disorders. We know we want to get the best treatment. We want people to improve as fast as they do. And sometimes they do. It's really amazing. Some people in 5 sessions can do well. Others need 30. And we shouldn't have that pressure and that condition of telling people how to work, basically do their intervention. So those are the two main areas that the unions have recognized, why are psychologists leaving. Another problem, obviously, is not only that people are leaving, we have university doctoral students that unfortunately don't choose to come to the public sector when they graduate. Only 25% of graduates come to the public sector, and the rest go to the private sector. So we have a difficulty retaining psychologists in the public sector, and we have a difficulty attracting them.
25, that's quite low.
Yes. Yes.
And have you found that during the pandemic, maybe there's even been a spike in people leaving the public sector?
Well, I don't do studies, but there's definitely a steady decrease of people leaving. And, just last week we had one retirement and one person leaving, and another person has, sick leave. So we're missing manpower, and it's everywhere in Quebec.
Okay, thank you. Thank you so much. Um, how would you say that, or would you say that the pandemic has brought attention to some flaws within the public mental health care system?
It definitely has. I mean, we are seeing over and over in the media the attention that mental health has got. We were happy to see that, there's less. I think, the pandemic has helped to put mental health on in media and on people's in people's conversation. More people are talking about it, and I think that has helped. Unfortunately, talking about it is not enough, and people have to have access. So we saw in the media, it came out that people don't have easy access. So we really saw the pandemic really showed us that there's not only a physical health crisis, and that there needed quick solutions. Like there was one very obvious flaw in the physical health sector, which was the CHSLDs. And, there was a quick fix in, hiring people, increasing the salaries of préposés aux bénéficiaires and getting them to get trained quickly and to work so the second wave wouldn't be so bad. And in the first wave, we were, very worried about the level of stress people were in. And we all said it like, oh my gosh, it's like a shock at the beginning, but it's just going to get worse if this continues. And then we heard there's a second wave, and then we thought, oh my gosh, people are so tired of this, and they're drained and they're demotivated. So it's going to take a big toll. So people who were asking for help, and they were told to call 811 and they would be redirected to services, but then they were put in waiting lists, and people heard it, and more people got dissatisfied of being told that they're going to be on a waiting list. So yes, you can talk to people, and I think it's so important. All the phone lines, the helplines, that was really good. The pandemic really encouraged people to call and talk about their difficulties. But if their difficulties are significant, and the numbers show that they pretty much are, some people have long-standing issues with mental health and they need treatment, and psychologists are the only ones who can provide an evaluation of mental health, psychological health, and they can provide the psychotherapy, which is a specialized treatment. And unfortunately, the people know that there's a waiting list to see psychologists, and that's 6 to 24 months. And people, I know there's been surveys saying people want psychologists. It's known. There was an Nanos poll, and I think it was like 95% of people want better access to the psychologists. So we know that was very important. And unfortunately, the government was, trying to fix this problem, and we can talk a little bit about what they did to highlight, to kind of recognize this importance, if you want.
Yes, please go ahead.
So I think what happened is that there was so much talk about the waiting lists that, you highlighted very well that people were told that you can go into the private sector. I mean, there's two options of the two-tier system, but it's not fair if you don't have the money. It's psychology and psychological services, psychotherapy should not be a luxury item that you only, certain people in the population should be able to have access. And then it took, unfortunately, the tragedy in October in Quebec City. And then, a couple of days later, we hear that there's going to be $100 million allocated to mental health, which is really welcomed. And we were really happy to hear that. But everybody knows that that's such a minor amount. It's such a small, minute amount. It was wonderful to see Mr. Scheffer in your report, Bertrand Scheffer, explaining that we need over 300 million, 500 million, to adequately take care of the people post-pandemic, because there's going to be such a high number of people with post-traumatic stress disorder. We already see the numbers of anxiety and depression. We know there's a lot of very vulnerable clientele. And there needs more money. So when we were told that there was $25 million, earmarked for private psychologists, so basically people who who are on waiting lists could be accessing a private psychologist and the government will pay. Well, obviously that shows that the government recognizes the importance of psychologists, the importance of putting money in psychological services. So we were happy about that. But the terms and the conditions were very, very strange. And it was just, again, showing that, I'm not sure if you know, but they were being paid at a higher, significantly higher amount than we get paid in the public sector. So it's kind of not fair, very bluntly. And their conditions are better. So the private sector psychologists get to pick, and they get to do what intervention they want without pressure on number of sessions. Whereas CLSC workers, like in your report, it said 10 sessions. So really, there's really been a lot of information out there, I think, for the pandemic. So we're really happy about that. It's very sad that it took a pandemic for this to come out. But there has been some changes. But we know, like Mr. Scheffer said it from IRIS, we need much more money to solve this problem, or else we're just going to put a Band-Aid on it and we're punting it forward, and the problem is going to still be there.
Mm-hmm. I just wanted to jump back to waiting lists for a moment. In terms of, I know you mentioned things like PTSD and depression, but when someone is maybe in need of immediate help, or, they would like direct help, and they're put on a 6 to 8 month waiting list, how might this further impact their mental health?
It's, you have a very good point. There's certain people that need emergency help. They're in a dire straits. There's people who have psychotic episodes, who are depressed and unfortunately think of harming themselves. They need to have access right away. And we tell people to go to their hospitals, to go to the emergencies. And that's where they can get immediate help. Other people are less severe. So they are calling hotlines, and they're getting some support. They're not getting psychotherapy, they're getting support. It's very different. And it could help. It could help decrease the crisis and really decrease your stress. But then, if you don't get treated after a certain amount of time, obviously the symptoms will still be there. And what could be harmful is that it gets worse over time. So if you're having bad thoughts, exaggerated thoughts about, going to school or going to work, sometimes it'll prevent you from actually going to school or to work. So then after that, what's going to happen? You've created an avoidant pattern, and then you feel better a little bit, but then after that, you're just going to feel guilty and worse. I let people down, so-and-so is going to have to do extra work for me. Or, when you're at school, you just have to catch up, and it's so hard, it's more stressful. So that's just one example. But over time, we know that things get worse. And, we're just talking about substance abuse. Many people with substance abuse there's underlying anxiety and trauma. So if you don't deal with the anxiety and the trauma, you're just going to keep on using. And unfortunately, again, like I said, if we don't go to the root of the problems with psychotherapy and proper treatment, we're just going to have a revolving door. So we're going to have a treatment that's quote unquote done in 5-10 sessions, because that's your limit in psychotherapy in the public sector. If that's what's going to continue, there's word of change, but we're going to hope that that's really true. But in the present scenario, like your person said on your report, there's many people that are limited to 10. what's going to happen is going to be a revolving door. So the person will have finished that and then, feel bad that, they still feel bad. They still don't feel well. And maybe they'll have another crisis and they won't know where to turn. And maybe maybe they'll become violent. So there's extra consequences. It becomes more costly. It's more expensive, for the system, because then they're going to go to emergency anyway, or they're going to go to their health professional. They'll go see their physician, their family doctor, and their family doctor. I don't know if you read one of our articles on the website. There was 698 physicians that supported us, saying we're not specialists in mental health treatment. We want more psychologists so they can treat them. People are coming to them. That is covered from the Medicare system, but they're not treating them unless they use medication. And again, medication is not always the answer. We know it definitely helps for certain people, but it's not always the answer. So it's a long-winded answer for you, but it's just showing you different steps of how people on waiting lists can have more chronic, more comorbid problems, so multiple problems, more chronic problems, and then end up costing the system more.
Of course, I don't think that question can be answered in a short form. So I appreciate you providing the detail. In terms of burnout, specifically in terms of mental healthcare workers experiencing burnout, how would you like to see them better supported?
Well, if you talk about burnout, we're talking about, a certain stress in the environment, in the work environment. And that's often because there's either unrealistic expectations, there could be a toxic relationship, there's no sense of control, no respect. There's many reasons why a person goes into burnout. So there's going to be many reasons of how I want to treat the problem, because we have to find out. I think everybody's individual, but globally, these people need to have a voice to be able to change their work environment. And sometimes we don't feel we have a voice, and we need to, get help to have that voice. So obviously, we encourage people to go get employment assistance. So it's like a program for so program assistance for, I don't know how to say that, employers who get psychological help paid by their employer. So there's definitely that available, which is good. So they can get stronger and, have the ability to go back to the workforce and try to make changes. But I think the bigger picture is that work environment is people in work environments, like people who are leaders, managers, are probably being more sensitized to mental health issues and the importance of giving people voice, respecting people's opinions, working together, and supporting one another. Obviously, I have a great work environment. I have great colleagues. We see each other after work, but that's not the case for many people. Some people are totally isolated, and with the pandemic, we're even more isolated because of telehealth, and we're working from home. And I think that there's been a lot of stress for people right now, losing their jobs, but also in work, being burnt out because the demands during the pandemic were so high. It was like, especially for women. There also are stats showing that women were a vulnerable group, that basically they were doing their work hours, 7-8 hours a day, and they were still responsible for childcare, primary responsibility for their house upkeep and chores. So I'm not saying that men didn't share. I'm just saying what the statistics show. And we really need to, again, work for equal rights and equal opportunities, because there's just too much stress. There's just too much stress in our environment. And we got to kind of question ourselves as a society where we want to go forward. I think the pandemic can teach us a lot of lessons of how we want to change individually, but also collectively as a group.
Very well put. Thank you. on the subject of burnout, not just for mental health care workers, but for anyone, how can we notice the signs of burnout and differentiate burnout between depression?
Well, it's like I said before, it's a fatigue, an extreme fatigue of issues related to work environment. Whereas depression, it affects all different spheres of your life. So, when you're depressed, you lose hope, and you have different difficulties in your thought patterns, and you have difficulties with your regulating your emotions, and difficulties with your behavior. So, some people withdraw, and they have even physical symptoms like physical health problems and appetite difficulties and weight regulation. So that doesn't all seem to be the same as people with burnout.
Thank you. So I know that, stigma has been a long-term conversation, when we're talking about mental health. And would you say that as a result of the pandemic, maybe you've noticed a decrease in stigma, more awareness provided towards mental health?
Yes, definitely. I think I would say that there's an improvement. But again, we're talking about things that I didn't research, so I could just say clinically my impression. I think that there's been a lot in the media, and older people are talking about mental health, which is so taboo before. So it makes me happy and proud to be part of this profession, because I think there has been change from the time that I started to now. But there's still a long ways to go. I mean, I'm happy that I see sometimes celebrities doing this, and whatever sports athletes promoting it, which again is very nice, because we need those role models for kids. Because still, I mean, teenagers, some of them want to get help, some of them think, no, there's no problem, whereas their parents, really want and see that there's some difficulty. So there still needs to be a lot of education and work with different levels. I'm talking about education system, the health system, the families system. So people need to all come together to recognize the importance of taking care of your physical health, but also taking care of your mental health, your psychological health. How do you think and feel? Because basically when you feel something, when you're kind of agitated, it's telling you something. It's really telling you something that you're missing a need in your life. You're missing something in your life. So if you're kind of feeling sad, you got to listen to that feeling. And I don't think we pay attention to that enough. And I think we kind of shush it up, or, kids who are having anger, oh, you're having a temper tantrum, and, just go to your room. And we kind of shut up the big feelings, where, sometimes it's good to take some time to kind of calm down, but we got to address it. We got to come together as families, parents, teachers, workers to talk about our feelings, because they really are alert signals to something's not right within you. And sometimes you just don't know, but we got to find different ways to get it out and to talk about it, because or else we've seen it with time, you're going to get a physical symptom possibly. And that's not good.
Thank you. So I know that you're also a pediatric psychologist at the Montreal Children's Hospital. I was hoping we could speak a little bit about child psychology. Could you tell me a little bit about how childhood events impact one in their adult life?
There's been a lot of studies showing trauma in childhood has an impact in the future. So there's been one huge study, it was the ACEs study, so adverse childhood life events, experiences. And they did show that kids who experienced more than one trauma, obviously it could be one, but even many kids have multiple traumas, do show signs later on of difficulty, of trouble with regulation of their emotions. They can have difficulty in relationships. They can have difficulty with emotions regulations, their behavior. And so it's not saying that you're doomed, but the more number of trauma events that you accumulate in childhood, the more probability it is that in adulthood you'll have difficulties. And these difficulties, if we look at, unfortunately, I'll give you a concrete example, is like the DYP situation. It's unfortunate, but there's so many kids that have been traumatized in their homes. They could be traumatized in other environments, of course. But then, they're put in worse scenarios, in other scenarios that we were trying to protect them, but then they're put in worse scenarios. And so the problems just get worse. People try to help them. I'm not saying DYP doesn't. They do an amazing job with the little resources they have. But sometimes there's multiple traumas that happen. So, kids will in the future, develop substance abuse or become more depressed. And so it ends up causing problems in the future if you're not going to help them in a young age during their young period. And again, I'm not saying you're doomed. Some kids are extremely resilient. It's a lot of factors. It's a multifactorial problem, trauma. And, we need to look at many different ways to solve that. And right now, if we're not going to do a good job in solving it, well, we're just punting it forward, like I said. And we are going to see the problems in adulthood, substance abuse, depression, domestic violence. There's situations happen that we end up seeing the behaviors repeat themselves. So as much as you say, oh, I don't want to be like my father who beat me, sometimes if you're not careful and you don't get the proper help, we end up, in a relationship that is resembling our childhood. And we need to be careful because, we don't want to do that. And so then after that, you kind of numb the feelings and you kind of possibly have some behaviors that you'll try to compensate and you want to repair, but sometimes it's really hard to do alone. And that's why psychological treatment is so important. And if you invest in psychological treatment, like Mr. Shefford said, now you will prevent problems. And it's actually going to be, how do you say that? Rentable. It's going to be an investment. So basically, there's studies showing that you put $1 in psychological services, the government will get a return investment of $2. And that's just one study. There's so many studies showing even more investment. So that's why when we say there's so much preventive work that we could do if people are treated young, if the people are treated even in adulthood. There's no wrong time to get help. People are malleable and resilient, and I do believe with proper treatment people can change. And then we will not have people coming to the emergency and crisis. So we're going to decrease costs there. We're going to have people who feel better and they can go get a job, and then they'll be feeling good about themselves and no longer be on unemployment insurance. So again, you will break the cycle, and I believe there's so much hope, but there needs to be proper investment in psychological services, or else we're going to just keep on having this revolving door of problems that are not solved young, they're not solved in the middle, teenage 20-year-olds, and they're not solved in 40-year-olds. They just keep on, repeating themselves or getting worse.
When you said about the $1, $2 return, is this in terms of, when people are getting services when they're younger, they're not maybe needing as much services when they're older? Exactly.
Yes, exactly. Absolutely. And then they're also becoming productive members of society, because we know that kids who've been, who have psychological difficulties might have learning difficulties and might drop out of school. In Quebec, we have a 30% dropout rate. It's really high. Really high. There was a study in Le Soleil, during the pandemic to highlight that. And Again, of course, we're going to try to put the money into tutors, and I'm totally for that. It's so good, so important. But why aren't kids able to focus in class? Is it just because they have, missed class, they've missed certain days because of the pandemic, they've missed so much work? Is it because of that, or is it because of that and other stressors in their lives? They might have a general vulnerability. They might, be weaker in math than in English, and that's fine. But some kids are having difficulty paying attention, not only because they were on Zoom, they're having difficulty paying attention in class. Yes, they might have an attention deficit disorder. They need a proper assessment. They don't just need medication. And they could be having difficulty paying attention because they have traumatic background. They have so much difficulty in their families that that's what they think about in class instead of focusing on learning. So it's not their fault, but they end up being, singled out, troublemakers, because they have to find another way of being valued. So sometimes they have super good social skills and they want to be the clown. And then they end up, failing and dropping out of school. Well, what happens then? Do they actually get a job? No, many of them stay home. There's a very high percentage of kids who drop out stay home. So we really need to be thinking long-term. Yes, Band-Aid solution. We want to give a little bit of money to solve the problem. If it's not going to be a large amount to pay the psychologists what they deserve so that they could come into the public sector, so that they could stay into the public sector, who is going to treat these people? They're not going to go to the private sector and pay. So we need the most vulnerable people, people with the highest risks, the people with the most problems, that are not going to be able to access services elsewhere. They need to be serviced. They need to be helped. They need to be treated. And that's only with psychologists, with the psychotherapy that is needed. For example, if we're talking about trauma.
Yeah, very, very, very important. It even got me thinking about when I was in high school, just the amount of students that would drop out, and just thinking about, there were counselors, but I don't really think that they're well equipped enough to deal with these kind of deep traumas. So I think it's very important to have more support and more professional help and sense of that. So thank you so much for explaining that. I just wanted to backtrack a little bit. When you said DYP earlier, could you just clarify what that is?
So that's the Department of Youth Protection.
Okay.
So we know that they're in the news nonstop. I mean, there's been over 100,000 signalements. So a year, 110,000 parents are being signaled, saying that they're either, suspected of abuse, neglect of their child. I'm not sure exactly how many are on the waiting list, but I think about 3,000 to 3,000 kids are on a waiting list. Once they're signaled, they basically need to be evaluated and they need to be taken in charge of intervenants and certain professionals. And then, depending on what the needs are, parents are either given parenting skills. Some kids have to get other services, evaluations and services. And again, we call it like the crisis center or the ICU of the mental health, because it's so problematic. Like these are really very high risk populations. And why is it that the numbers don't go down every year? Why is it the numbers keep on going up? There's been studies showing that child abuse is such an expensive, it's such a high cost for society, and no one talks about it. It's as if it's, again, we're talking about taboo topics. We need to start talking about child abuse. We don't like talking about it because we all feel kind of guilty of, oh, I screamed at my kid, and my parents used to slap me on the butt so I could slap them on the butt. So a lot of people feel judged, and I think we need to start talking about it, because we need to treat these children who are witnessing domestic violence, and it's in the news all the time, and they are victims of abuse, either psychological or physical. And when they are traumatized like they are, simple fix, simple band-aids are not the solution. Some kids are very traumatized. If you're not going to help them properly with psychological treatment, you're going to have the problem in the future with substance abuse. You're going to have them possibly repeat the pattern and become a victim or a perpetrator of domestic violence. So again, why think short-minded, we can't be short, have a vision of just 2 feet ahead of us. We need to be able to think, what are the causes, what are the roots of this societal problems, and invest properly in real solutions, because it's not working. Psychologists are leaving, problems are getting worse in the society, physicians are getting swamped with requests that are mental health related. And then our famous, I'm going to say his name again, Bertrand Scheffer, tells us that only we should invest more. So let me tell you this: 6% of the health budget is allocated to mental health services. Only 6% of the health budget. When 25% of mental health, when mental health problems are the root of 25% of physical health costs. So thinking about that, we're saying they're costing, mental health problems are costing us in the long run. So might as well increase the budget initially. And Mr. Scheffer said 0.12% increase. He said, like, you need about 500 million to get psychotherapy, get people proper psychotherapy post-pandemic, 500 million. It seems like a lot of money for us, but when you analyze the stats, I'm no taxpayer. I'm a taxpayer, but I'm not a person who knows all the money and details. But when you tell me that it takes 500 million, and that's only 0.12% more of a budget, that's not a lot of money. People, we don't know this as taxpayers, but 6% only is spent on mental health when we know that the costs later on are 25% of physical health costs. It's just really outstanding. We need to increase that budget. That to me is so important. And I think as taxpayers, we're all going to get more aware. And we need more people like Mr. Scheffer to talk about those numbers, because that was an eye-opener in your report.
Thank you so much. On the note of funding, in my report, for people who didn't watch it, Bertrand Shepard, a researcher for IRIS, he brought forth that the Quebec government should fund $500 million more towards mental health care. I also talked about, different ways that we could seek this funding in terms of providing a higher tax on people with larger incomes. I wanted to know your opinion on this a little bit, and maybe what do you think would be the best way that we should seek more funding for mental health care services?
Well, again, I'm going to repeat that the money's there. Taxpayers pay their dues and the money is there. But why are we only allocating 6% to mental health? So we know that there's something that needs to be done. I'm not a tax specialist, like I said, but I know that there's different people are allocating priorities differently, and physical health is so important. Schools are so important. The mental health is too. And your solutions, I think, of taxing the rich more. I mean, I'm sure they thought about that. The rich, I think, there's different categories of wealth, and you were saying the excessive wealth and people who've really earned and benefited from the pandemic should pay more. That sounds good, but why hasn't that happened already? Why haven't people done that? There's got to be reasons. I think that we have professionals that are looking into that, and they've never done that because, maybe there's, I don't know, fear of them taking their money elsewhere, because, we need to have and taxes, there's no doubt, but there's a certain amount of taxes that people can bear. I mean, there's certain people that are paying 50% taxes once you hit a certain bracket. I mean, it's not even a lot. I think it's 100,000. So it's people in Quebec are super taxed. If we're talking about the super wealthy, $1 billion of revenue a year, I think we're talking about something very interesting there. But, why hasn't the government done that? There must be reasons, because they're afraid probably they're going to take their business elsewhere. I don't know. I'm not a tax expert, but I'm sure they've thought about that. But I really do think that the society coming up, standing up together, your generation is outstanding with, these marches and these protests, and there's just so many people are talking, and surveys show that people want psychological help, and they want it to be accessible. They want it to be easy. It shouldn't be going through hurdles like right now. They're calling, and then sometimes they're going to get service, and they're in a waiting list, and they can only get group work, and they don't want group work. They want individual. It should be easy, and I really do think that more people need to put pressure and stand up and say, this is our right. We pay taxes, and we should be able to have services in a reasonable time delay.
Thank you very much. I know there's so much to say on this topic, but I just want to shift back to a little bit about specifically mental health being impacted by the pandemic. As you know, we've been experienced many lockdowns, kind of what seems a little bit endless. I've been wondering a bit about social anxiety, and when we're coming out of these lockdowns, would you say that this long-term isolation can maybe develop social anxiety in some, or people who are already experiencing this maybe further this social anxiety?
Yes, for sure. For sure. I think that your guess is good as mine. I think that people who are vulnerable are definitely going to have difficulty. I mean, we saw it just recently with the teenagers being told that they were doing one day at school and one day online. And then they were recently told, no, you're going online full time now. Wait a second. There's variants. There's, so much talk about a third wave. And there was kids saying, I'm writing petitions. I'm writing, I don't want to go back to school. I mean, I'm scared. And so there's, how much of it is fear that is rational fear, and how much of it is, anxiety, meaning that it's something that is exaggerated, or something that needs to be worked on. And I do agree that some people are very shy initially, so they've been at home and it's been helpful for them because they're introverts, and being home and learning online was okay for them. But going back to school is hard, so we do recommend that they prepare ahead of time, and try to get some exposure, social exposure. We're allowed to go outside, we're allowed to socialize with a certain number of people. So, getting back gradually is a good technique. And some kids, really suffer from social anxiety and they get sick. So they should be able to go back to school gradually too, and not feel so forced.
Thank you. What would you recommend for someone who is experiencing a mental health crisis and they're maybe in need of immediate assistance in Montreal?
I think they need to go immediately. If they're in danger for themselves, harming themselves or anybody else, they need to go present themselves at the emergency of any local hospital. They're open, all the time, so they should be able to get access immediately. When other people think that they're in crisis, we want them, and they don't think they're going to harm themselves or others. Obviously, the most important thing is to talk about it in their home, with their friends, and if they have to, because if they have no one, which sometimes happens, and it's too late at night to speak to someone, there are hotlines, and it's very good to be able to share. And we have great community resources that are available. And I think that can help to decrease the crisis. But again, speak to your physician, speak to your family doctor, your pediatrician, ask for help. And then maybe if you can, to get yourselves on a waiting list in the CLSCs, because that's the open door entry for psychological help in the system right now, is calling 811 and asking to have psychological services. If they're telling you that no, you'll have to see a social worker first or a nurse and get triaged, that's fine. Go through it. Be patient with that process. And then after that, demand to see a psychologist, because what happens sometimes, we have this PQPTM, a Programme de Troubles Mentaux au Québec, is that there's a step program, and many people will be encouraged to do self-help skills. Some people don't want that. They've already tried everything on the internet. Then they're told, oh, you need to try group education sessions. And some people like that setting, but again, some people don't. So if it's not for you, you should request and demand, that's your right, to go to the next step, which is psychotherapy from a psychologist. Some people are told that they could jump some steps because they're in depression and they're not well and they're, not able to go to work or to school. That's severe. When you know that your functioning has been affected, you need to be able to get help immediately, and telling the person on the other line that this is more severe and calling back again and again if you have to get heard is important.
Thank you. I know that there's probably so much more that we could talk about here, but is there anything that I didn't ask that you would like to share?
I think we talked a lot about all the different topics. Let me see. I just, one last thing. It's really important that people have, the ability to share what they're going through. I really hope that this helps people to know that they are important, they're valued. Everybody's important, everyone's valued, and we need everybody. Everybody in the society is put here for a reason. They can contribute. It could be right now that you're volunteering, you're helping your little brother, you're helping a friend, you're helping your grandmother. You are important right now, and you can contribute in the future. You might not know what your job is in the future, or you might have a job and you might be dissatisfied with it. But you're important. That's basic important. You need to know that if you need help, get the help. And if you want to, write letters and be more vocal, get together with a group and do it, because every voice, every vote counts.
Thank you. Thank you so much for taking the time to speak with me and share all of this important information tonight.
Thank you so much for having me.
Thank you. And thank you everyone for tuning in. In a few minutes, I'll be posting some hotlines down below in the comments. And if you haven't checked out the recent episode of Local 514, please do on the CUTV Facebook page. Thank you, everyone. Have a good night.
Good night.